Drop of rain inside. Haley?
All right, thank you, John. Well, Secretary of State Hillary Clinton's blood clot inside her skull made headlines, and Dr. Dean Sutherland is here to explain more about the seriousness of this condition and how it can be treated. Dr. Sutherland, thanks for being with us.
Good morning, thank you.
So, of course, everyone is talking about this, and she had a concussion because she had been sick and dehydrated. But there's a kind of, we're not sure what caused what. So explain that.
It's kind of the chicken before the egg sort of thing. Did you have a clot in your brain and then that made you susceptible to falling down, or vice versa? And we just don't know in this case. So really in 40% of cases, we have no idea why people get these clots. Most of the time they're in other parts of the body, they're in the leg usually.
But explain where this one was, or is, I guess.
Well, it's in the brain, but it's actually in between two parts of the brain, which is the cerebrum and the cerebellum, and this thing called the transverse sinus. And it goes right around the back here, and it drains into this jugular venous system. And so it's a very large vein. It's one of the largest veins that we have in the head. But so to get to that large vein, you have to have smaller veins that come into it. So that's where the concern is. It's not really the blockage in the large vein. It's the smaller veins that then also have little clots in them that are in the brain. And you can get something, it can get a stroke-like syndrome from that.
And it can be fatal, but luckily for her, it didn't actually cause any major damage. Or how do you know when how does someone know that they may have a blood clot? Are there even symptoms?
You know, the first symptom is a headache, which so many people get, right? So
all the time,
so that's very, you just don't know. But some people can also get confusion, or as I mentioned, stroke-like symptoms that are more slowly progressive than a typical clot in an artery. And so they can feel like they have pressure, they can have some vision changes. It can be very hard to determine. But there are certain people that are more at risk, and we kind of look for it more.
Okay, and who are those people?
Well, pregnant women. So on the maternity ward, when people are delivering, you know, if they develop a headache, especially if they have a seizure at that time, then we really start to look for that. People with clotting disorders who have multiple clots from before in their legs, like Dr.
Hillary Clinton actually did,
Hillary Clinton did, yeah. That's right. Back in 1998, she had one in her leg. And she had
may be more susceptible to clotting.
Right.
Okay.
Right. So there are autoimmune diseases that make you more susceptible to clotting, and there's also deficiencies that some people have in their blood clotting system. So, you know, it's a fine balance between forming a clot and breaking a clot up. So if you have one or too much of one or the other, then you can cause either bleeding or clotting.
That's right. So it is. So how do you treat it if you find out you do have a clot?
Well, first off, you need to find out how severe it is, where it is, and then what you need to do about it. So the treatment usually is anticoagulants, which is usually Coumadin, because we have so much experience with Coumadin. But now there's 3 or 4 other ones on the market, 3 or 4 other anticoagulants. We don't know how effective they're going to be for treating this one thing that Hillary Clinton has, but I suspect they will be. Okay,
and when they do the blood thinning medication, does it completely remove the clot or just make it smaller? How does that work?
About 1/3 of the time it still stays there and is blocked up. 2/3 of the time it can actually what we call recanalize, which means the clot can get drilled out again by your own body systems. But that takes at least 6 months up to a year, and it's certainly not a guarantee. Okay.
So there's a lot of unknowns about this and a lot of different factors depending on your condition. So as we always end this segment, if you are having any of those symptoms, see your doctor.
That's right.
All right. Thank you, Dr. Sutherland. We'll be right back.
In Florida, 1 out of every 3 drivers does not have liability insurance.